On the occasion of World Cancer Day, today we are going to talk about cancers in women. The most common cancer affecting women in India is breast cancer. Apart from that, the other cancers are cancer of the ovary, uterine cancer or endometrial cancer, and cervical cancer. Whenever we talk about cancer, we talk about two aspects of cancer. One is the cancer prevention and other is the cancer treatment. Coming to the cancer prevention, the most common cancer in women which can be effectively prevented is the cervical cancer, which is caused by a virus called human papilloma virus. Nowadays, we do have very effective vaccines against this human papilloma virus in the market. And if it is administered at a proper age, it can prevent cancer in up to 99% of women. Now, coming to the treatment of the other cancers, we do not have any effective means of prevention. So we try to detect them early. Because earlier it is detected, better is the treatment outcome. Coming to the breast cancer, I would appeal to all my viewers that you can learn self-breast examination. There are very good videos in the internet so that you can get to know that what are the changes that if you find any suspicious lump or anything, you can come directly to the doctor for a clinical breast examination. And in women above 40 years of age, yearly screening with mammography or ultrasound of the breast is recommended. Coming to the ovarian cancer. Now, the ovarian cancer is known as the silent killer because it does not produce much symptoms before it becomes of late stage. But a woman can have problems like early satiety, weight loss, fatigue, abdominal discomfort, or a bloating sensation. Many a times which women think that these are because of some gastrointestinal problems can be the early symptoms of an ovarian malignancy, especially in women of elderly age group, perimenopausal or postmenopausal women. If they are suffering from this kind of symptoms, they should come and consult their doctor immediately. There are a few blood tests which we call the tumor markers like CA125, HE4, CA19-9. If it comes at a very high level, it raises the suspicion of ovarian cancer. And we do have effective imaging like scans and CT scans, MRIs, which can pick up very early lesions. Now, coming to the endometrial cancer. What is an endometrial cancer? The endometrium is the inner lining of the uterus from where the bleeding due to the menstrual blood comes. What happens is that this endometrial cancer can affect women. Usually it affects women above 40 years of age, but it can affect women below 40 years, especially if there is risk factors like any family history or if there is obesity or the woman is taking some medication which increases the action of estrogen in the body. Fortunately, for this cancer, there is a long latent phase during which there are precancerous changes in the endometrium before the actual cancer develops. So we try to detect endometrial cancer during this stage, and because at this stage it produces usually the symptoms such as irregular bleeding or very heavy bleeding. So if these symptoms are happening in a woman of a perimenopausal age group above 40, 45, they should immediately consult their doctor. What I would suggest that we do not know that what causes a cancer exactly. There can be environmental factors, there can be genetic factors, there can be lifestyle factors, and we call it a modifiable and non-modifiable factors. So if you are having symptoms which are not normal, you think that which are not normal, if you are having a positive family history of cancer, you should consult your doctor. Be aware, be safe. Thank you.